Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Complication, complication, Complications of malnutrition. Number 4, dehydration. In dehydration, first you will have to identify the oliguria or whether there is increased thirst. So, if you identify oliguria or increased thirst or presence of weak pulses or hypothermia, then that means there is dehydration. Then all children with severe acute malnutrition should be considered to be in some dehydration. Only indication of intravenous fluids is severe dehydration with shock. Generally, in dehydration, we prefer oral fluids for children. So, preferred oral fluids are half strength or low osmolarity ORS solution. That is, the low osmolarity should be around 245 milliequivalent per deciliter ORS solution. So in the ORS solution, you will have to give 2 liters of water and 40 ml of mineral mix should be given along with 50 grams of sugar or 45 ml of potassium chloride can be given. So these are the preferred oral fluids. Start giving oral fluids in the ratio of 5 to 10 ml per kg per hour and slowly increase the oral fluids to a maximum of 12 hours. Then intravenous fluids. In intravenous fluids, you can give ringer lactate in 5% dextrose or N by 2 in 5% dextrose. You can use 15 ml per kg over 1 hour. You should give ringer lactate. For IV fluids, you can also give ringer lactate is the preferred one. In ringer lactate in 5% dextrose is the preferred one, or you can also give N by 2 normal saline in 5% dextrose 15 ml per kg over 1 hour and then reassess the condition. If the patient is still in shock, then you will have to repeat the intravenous fluids. If improved to severe dehydration without shock or some dehydration, then you should give oral fluids to the child.
thank you and thank you for watching.